I'm Dr. Krishna Naidu, trauma and orthopedic consultant specializing in arthroplasty and sports medicine. I work for Columbia Asia Hospital, Sajapur Road. Hip and knee replacement is a surgery which is for the betterment and quality of life. It is a myth that most of the people understand that they are patients, which is not true. Most of the people who walk into the hospital with a knee pain is coming with a hope that they want a better quality of life so that they can play with their grandchildren, travel to see them if they're settled abroad, or they want to do what they enjoy the most after the retirement. But unfortunately, most of the people are in fear that it is not very successful and they get taken back by the experience of their friends or colleagues who have undergone this. It is fact that the human mind captures the fear the most. Hence, any negative feedback of a hip and knee replacement is very well taken by individuals and it is hard to revert back. Please do mind that I do advise hip and knee replacements based individually and tailor-made for the individuals of what their expectations are. None the fear that I tell them it is mandatory. As you are all aware that the average lifespan of human being in India has significantly rose from 60 to 70 and is consistently increasing with the advances in the medical sciences. Our knees and the hips are not designed to last that long. The articular cartilage within the joints do wear off after a certain period of time, and usually you see them once they cross 50. My recommendation or advice to the patients is normally that before they come in to see me or think about the knee replacements, it is they themselves should be aware that what their expectations are. My recommendations to the patients is that they have a positive frame of mind. My best experience is treating a patient who was absolutely positive of what he wanted with regards to the knee replacement, and he walked out of the hospital within 2 days without any pain. Pain is perception. It is different to every individual. The better outcomes are seen with patient being completely involved into the surgery and understands what he is going through. Otherwise, most of the complications, the dreaded complications I would rather call, is seen with the reluctance in patients who was keen to go ahead with this. So getting ready for a knee replacement or a hip replacement comes within. As long as you are aware of what you need from your life in terms of quality improvement, then we would be able to help you and offer you the best treatment available and the best world-class infrastructure.